What happens if lung cancer targeted therapy fails? Imagine you are fighting lung cancer with targeted therapy, which is designed to attack specific gene mutations in cancer cells. It can be very effective, especially for patients with mutations like UGFK, ALK, ROS1, or RET. But sometimes, despite the initial success, the therapy stops working. This is known as targeted therapy failure, and it can be a challenging moment for patients and doctors alike. One of the main reasons targeted therapy fails is resistance. Cancer cells are clever and can adapt over time. They might develop new mutations in the target gene, making the drug less effective. For example, in patients treated with drugs targeting the UGFK gene, secondary mutations can appear that block the drug from binding properly. Sometimes, cancer cells activate alternative pathways to continue growing, bypassing the blocked pathway. This resistance can happen after months or even years of treatment. Another reason is that targeted therapies only work if the tumor has the specific mutation. Not all lung cancers carry these mutations, so many patients do not benefit from targeted therapy at all. Even when they do, the cancer can evolve and become resistant. Additionally, targeted therapies can cause side effects, such as skin rash, diarrhea, or liver issues. If these side effects become severe, doctors might need to stop or adjust the treatment, which can also lead to failure. When targeted therapy no longer works, doctors have several options. Chemotherapy remains a common choice. It uses drugs that kill rapidly dividing cells and can be effective even if targeted therapy fails. Immunotherapy is another promising option. It helps the immune system recognize and attack cancer cells and has shown good results in many lung cancer cases, especially when targeted therapies are no longer effective. Radiation therapy can also be used to shrink tumors or control symptoms, especially if the cancer is localized. Clinical trials are an important part of the next step. They give patients access to new treatments that are still being tested. Sometimes, combining different treatments, like chemotherapy and immunotherapy, can improve outcomes. It's crucial to remember that each person's cancer is unique. Factors like genetic makeup, overall health, and previous treatments influence what options are best. If targeted therapy stops working, it does not mean the end of treatment options. It is essential to work closely with healthcare professionals who can evaluate the situation and suggest the most appropriate next steps. Advances in medical research continue to improve options for patients, and personalized treatment plans are key. Understanding why targeted therapy fails and exploring alternative therapies can help manage lung cancer more effectively. Always consult with your medical team to find the best approach for your specific case.